Hi, today we're going to discuss the difference between Myasthenia Gravis and Lambert-Eaton Syndrome. It's quite a common question in your exams, be it NEET PG, MRCP, PLAB, UKMLA, USMLE. It usually comes in an exam in various different formats. So we're just going to refer to this table here. The first one is the Myasthenia Gravis here, and the second one is the Lambert-Eaton Syndrome. So we can see the symptoms and then the onset, pathophysiology, and the cause. So in the Myasthenia Gravis, usually the symptoms are worse with activity, which is very important, and it kind of improves with the rest. So it's opposite in Lambert-Eaton Syndrome, which improves with activity. We're just going to discuss briefly later why is that so. But for now, just kind of remember it kind of Myasthenia improves with the rest, and Lambert-Eaton improves with activity. So it's better to exercise. E for Eaton and E for exercise gets kind of better with exercise. And Myasthenia, if you know, it usually starts with your eyes and face, like muscles, like ptosis and dysphagia, swallowing difficulty, while Lambert-Eaton is mostly in the proximal limbs. And another most important difference which do come in exam is the autonomic nervous system involvement, which is much more common in Lambert-Eaton syndrome as compared to the Myasthenia Gravis. And also you can see reflexes absent here, and they're usually preserved reflexes in Myasthenia Gravis. So autonomic nervous system and reduced reflexes is in Lambert-Eaton syndrome. So you see all the autonomic features here, like dry mouth, erectile dysfunction, and things like that. So that's also important differentiation point here. So onset, Myasthenia is usually, it's like women younger than 40 years of age or men older than 60 years of age. So that's kind of important to remember. While Lambert-Eaton, because it's associated with mostly cancer, so it has to be in middle age or older adults. So what is the pathophysiology? Like coming to this diagram here, the Myasthenia, the problem is in post-synaptic muscle membrane, that these receptors, the acetylcholine receptors here, the antibodies attached to these receptors. So now the acetylcholine cannot attach to the receptor anymore because it is being blocked by the antibodies. So obviously, then you see the muscle weakness. While in Lambert-Eaton syndrome, the problem is presynaptic. Here, presynaptic. So there are channels called VGCC, which is like voltage-gated calcium channels, and they are blocked in Lambert-Eaton syndrome by the antibodies. So because these calcium channels are blocked, which are presynaptic, and they help in releasing the vesicles, acetylcholine, into the postsynaptic membrane in the cleft. So by blocking these receptors here, there'll be less acetylcholine release into the cleft. So just to briefly summarize, so Lambert-Eaton syndrome, you see the antibodies blocking the presynaptic VGCC, and thus less acetylcholine is released into the cleft. So that's why the pathophysiology in Myasthenia Gravis, it's a neuromuscular junction problem, while this here Lambert-Eaton is a presynaptic calcium channel problem. Going to the next phase of difference. So in Myasthenia, it's usually associated with thymoma, you know that, yeah? And while the Lambert-Eaton, as we discussed, is common with cancer, most commonly small cell lung cancer, which is quite important and comes in exams. So the autoantibodies, the most common autoantibodies with the Myasthenia Gravis is anti-acetylcholine receptor antibody, and the other could be anti-MuSK. So if anti-acetylcholine antibody receptor antibody is negative, then you should send anti-MuSK levels. It could be positive in Myasthenia. While in Lambert-Eaton, as we discussed, is anti-VGCC, which is voltage-gated calcium channel. So how do you diagnose? You obviously send the blood test for all these antibodies, and then you do an EMG. And again, as we discussed, because Eaton-Lambert syndrome gets better with exercise, so EMG would show incremental response with repeated nerve stimulation, while the EMJ, which gets better with resting in Myasthenia, it would show decremental response with repetitive nerve stimulation, which would mimic an exercise. And again, you have to do an imaging to rule out thymoma, and you have to do a CT scan to rule out lung cancer in Lambert-Eaton syndrome. So how do you treat? So you treat by giving anticholinesterase inhibitors in Myasthenia, which is like pyridostigmine, and otherwise you have to give immunosuppressants. And you can also get rid of the antibodies in the plasma by doing plasmapheresis or IVIG. That's usually kind of reserved in myasthenia crisis. In normal myasthenia patients, this is the treatment here, either the inhibitors or the immunosuppressants. And you can also do thymectomy if the thymoma is present. That usually helps to resolve the symptoms. While in Lambert-Eaton syndrome, 3,4-diaminopyridine is the drug of choice. 3,4-diaminopyridine. It increases your neurotransmitter release, which is the acetylcholine release in the cleft by blocking the potassium channels. So this is a drug of choice in Lambert-Eaton syndrome. And also other treatment is kind of similar to myasthenia here, which is like immunosuppressants and plasmapheresis or IVIG in crisis. And also you have to treat the underlying cancer, because treating the underlying cancer can also help in resolving the symptoms of Lambert-Eaton syndrome.